Welcome back. If you suffer from lower back or leg pain, it could be caused by something called spinal stenosis. So you might be asking, what is that? And Dr. Brad Goodman from Alabama Ortho Spine and Sports joins us now with more on that. Thanks for being with us today.
Thank you for having me.
So first of all, let's tell our viewers what spinal stenosis is.
Spinal stenosis is an arthritis of the back, a degeneration of the back, where the ligaments and joints get overgrown through time and start putting pressure on the nerves.
Okay.
And then this pressure causes a problem known as claudication or neurogenic claudication, and that causes pain in the back and legs, especially when the patient would stand and walk. And generally they get very good relief by bending over. So they will want to sit down, or they're always looking for the shopping cart in the grocery store. That gives them a lot of relief to bend over the shopping cart. Yeah.
So you were telling me that it typically happens with people who maybe are in their 50s. Could this happen to anyone who's a little bit earlier, like say in their 30s, or what's the typical age?
The typical age is 55 and over. It's generally a degenerative process where the tissues get overgrown. So in the 30s, you're dealing more with ruptured discs and cysts in the back, but this is more in the elderly population.
So you brought this for display, and there's a product that can actually help provide some relief. Tell us about it.
So for about 2 years, we've been putting in a small, what I call a jack in the back. It's called a Superion implant. And this implant fits between the bones in the back, and it's put in through about a 1-inch incision.
Wow.
And it just fits between these bones. And what it does is patients get relief by flexing, but they get worse when they bend backwards. So this little jack sort of blocks that segment's ability to bend backwards, and it indirectly provides a little bit of decompression of the nerves.
So if someone is maybe in that age range that you mentioned and has some back pain, when should they seek a doctor?
So they should seek a doctor if it's affecting their quality of life.
Okay.
They can't walk as far, they can't stand for a long period of time to do whatever chores they want to do. So if it's really affecting their quality of life, they can't golf, things like that, they should go see a doctor. Then the question is can we improve their quality of life through a minimally invasive procedure? Typically,
like
this is treated with a very big back surgery. So this is preventing a much bigger operation, and it doesn't burn a bridge. It doesn't prevent a patient from getting a larger operation.
Very interesting there. Well, Dr. Goodman, I appreciate the information. Thank you for sharing it with us today.
Thank you for having me. Appreciate it.
Mickey?